the best foreskin care. Hello, what I want to talk to you about today is foreskin and care of the foreskin. I know many men have problems with the foreskin, and many babies and toddlers have problems with the foreskin, and it's up to them, the parents, to try to find the best way of looking after it. So I'm going to share with you some information that makes it a lot easier for you to care for the foreskin and to stop any future problems with it. Okay, right, 99%, over 99% of problems with the foreskin are caused by fungal infection. It's completely natural to have a fungal infection on the end of your penis, and what I mean by that is it's dark, it's warm, it's moist, and there's plenty of food. So given half a chance, a fungus will start to breed on the end of the penis. The problem is, once the fungus starts to eat the very thin skin of the foreskin, the natural immune response is to send lots of cells and killer cells and all of that, so the foreskin swells up trying to protect itself, and it becomes very sore and painful to touch and even painful to look at. Now what can happen as well is that the infection or the inflammation can spread through to the end of the penis, the gland, so you could have an infected foreskin and an infected gland as well. Now some people think that having a problem with the foreskin, it's about poor hygiene, poor personal hygiene, and it's not. It's not. You can't wash fungus off the skin. You can do the normal bathing, wash yourself all over, wash it. If you do get a fungal infection, it's because of you, for some reason or other, you've got a weakened immune system, which has allowed that fungus to breed. Now normally we're covered in all kinds of creatures, including funguses, which we need as part of our immune system. So we use fungus as part of our immune system to protect us. So we've got funguses that kill off these other funguses. But if they haven't done their job properly, then you end up getting a problem with the foreskin. Okay, so what can you do? Well, you can go to the doctors or the drugstore, and they will say, oh yes, listen to you sympathetically, and they say, no problem, and they will sell you this generic toxic cream. This white stuff, which you're supposed to rub onto the end of your foreskin, inside the edges, around the gland, and it will kill off most of the fungus. Most of it. But it is a weak ointment, and it doesn't kill off all the funguses. So the moment you stop applying it, within a week, it's come back and the inflammation has come back. So what else can you do? So you can go to the doctors or the drugstore and say, well, the cream didn't work, I'm trying to care for my foreskin, I've got this infection, what else? This is where they send in the big guns. Fluconazole, or there are other variations of this, but they all end in azole. These are very toxic drugs. That's why in a box this size, you'll have a massive leaflet telling you all about the side effects, including anaphylactic shock and death. But apart from that, there's only one capsule in that big box, because you only need one capsule full of toxic drugs to kill off all the fungus in your body, which you need for your health, and it kills off the fungus on the outside of the body, which you also need for your health. Now it might kill off the fungus on the end of the foreskin, but it's killed off the natural funguses that you need. So within a month or so, I mean, if you take one of these, the foreskin problem will appear to go away. You might have terrible digestive problems, you might have vomiting and diarrhea, you might have arrhythmia, you might have breathing difficulties. All of these things are there in the small print. You might have a damaged liver for life, but it will appear to get rid of the fungal infection, but then it comes back in a month or so later, because it's also killed off the beneficial funguses that you needed in your immune system. So that, don't do it. It's out of the question. So what can you do? And this was what we looked at 12 years ago. We were looking for it's got to be effective, an effective remedy for inflamed foreskins, for infected foreskins that could cure the problem but without damaging the immune system. And we came up with this remedy here. I don't know if you can read that. Balanitis Doctor. In here is a blend of 4 very powerful natural antifungal plant extracts. Plant extracts which have been proven to kill. Just a couple of drops like that. Massage it onto your skin. Couple of drops. You put it on 3 times a day. And it's the same, doesn't matter if you're a baby, a toddler or a grown man. It's the fungus doesn't know what you are. You just kill the fungus off 3 times a day. You do it for 3 days. 9 times out of 10, that's it, it's gone. But what you've got to do after that is use it once a week to stop the inflammation from coming back. That's the Balanitis Doctor. See, an inflamed foreskin, it's more a reflection of your immune system. It's not about hygiene at all. You can have a very, very perfectly clean body and still have an infected or inflamed foreskin. Kill the yeast with the plant extracts, and then once it's gone, after 3, maybe 4 days, usually 3 days, it's gone. After that, once a week to prevent it from coming back. Okay? That is the Balanitis Doctor. Now there is a link to this product below this video. So if you click on the link below the video and you're happy with the information, you're happy with the ingredients and all the background, we can send it out to you today. We'll send it out to you. When you get it, there's the technical stuff showing the safety and health and safety and the ingredients and what have you. But more importantly, it will be this bottle. It's 100% organic. It's pure. It's Mother Nature. You only use a few drops. Just a few drops is all you need. That's it. After that, use it once a week. It'll last you a minimum of 6 months. A minimum. So, and that's it. That's the Balanitis Doctor. So, foreskin care is Balanitis Doctor. Foreskin care. Okay. So, look forward to helping you. You could help us by subscribing to this video. We're always wanting to share more information with you. If you've got any questions, go onto the website, see if there's any information there. If you can't find the information, drop us an email or pick up the phone. We're happy to speak to you and help you out. All right. Bye for now.